What if I told you that a single missed warning sign could change a baby's life forever? Or that one nurse can sometimes spot a life-threatening problem before anyone else in the room? Most people never think about this. Until it is their child. Until it is their family. And by then, everything changes. Let's destroy a myth right now. Most people think maternity and pediatric nurses simply follow doctors' orders. Take temperatures, check vital signs, hand out medication. That is what television shows you. That is not reality. Reality is far more intense. Reality is a nurse noticing a newborn isn't breathing quite right. A mother isn't recovering the way she should. A child suddenly becomes unusually quiet. Small details, teeny changes. The kinds of things most people would never notice. And sometimes, those tiny details become the difference between a routine hospital stay and a medical emergency. Nobody talks about that. But they should. Imagine this. You are a first-time parent. You've spent months preparing. You painted the nursery, bought the stroller, read the books, watched the videos. You think you are ready. Then the baby arrives. Suddenly everything feels different. Every cry sounds important. Every movement feels significant. Every decision feels enormous. Now imagine sitting in a hospital room after delivery. Friends are texting. Family members are celebrating. Pictures are being taken. Everyone is focused on how beautiful the baby looks. Meanwhile, a pediatric nurse notices something unusual. The baby isn't feeding effectively. The breathing pattern looks slightly different. The skin color changes for just a moment. Nothing dramatic, nothing obvious, nothing that would alarm most parents. But the nurse keeps watching, keeps assessing, keeps paying attention. Doctors are informed. Additional evaluations are ordered, treatment begins, and a potentially serious complication is addressed before it becomes a crisis. Here is the part nobody tells you. This type of story happens every day. Not because nurses are lucky, not because they guessed correctly, because they are trained to see what others miss. Here is the uncomfortable truth. Most people dramatically underestimate how quickly mothers and children can get into trouble medically. Pregnancy is natural, birth is natural, childhood is natural. But natural doesn't mean risk-free. A newborn's condition can change rapidly. A postpartum complication can develop unexpectedly. A child can appear fine one moment and significantly worse the next. And, here is where things become dangerous. Many serious conditions begin with subtle symptoms, not dramatic symptoms, not movie scene symptoms, subtle symptoms. A little more sleepy than usual. A little less interested in feeding. A slight change in breathing, a small increase in discomfort. The problem: most people are waiting for obvious warning signs. But healthcare professionals know something important. By the time a problem becomes obvious, valuable time may already be gone. That is why observation matters. That is why assessment matters. And that is exactly why specialized nursing exists. So why are mothers and children considered unique patients? Because they aren't simply smaller adults. Let me be clear. A newborn is not a miniature adult. A toddler is not a miniature adult. A pregnant woman isn't experiencing healthcare the same way as every other patient. Everything is different. Medication dosing, developmental stages, communication abilities, physical responses, emotional needs. A newborn can't tell you they're struggling. A toddler can't accurately describe symptoms. A frightened child may communicate illness through behavior rather than words. Meanwhile, many mothers are so focused on their newborns that they may ignore symptoms affecting themselves. And that is where risk increases. Maternity and pediatric nurses are trained specifically to understand these differences. They know what normal looks like. More importantly, they know when normal starts becoming abnormal. Quick question: who spends more time directly observing patients? Doctors or nurses? Most people answer doctors. They're wrong. Nurses often spend significantly more direct time monitoring patients throughout a shift, hour after hour, assessment after assessment, observation after observation. That is why some of the most important clinical discoveries begin with a nurse saying, "Something doesn't look right." Never underestimate the power of that sentence. So what exactly do maternity and pediatric nurses do? Much more than most people realize. They continuously monitor mothers during pregnancy, labor, delivery, and recovery. They evaluate newborn health. They assess feeding patterns. They track developmental concerns. They educate parents. They support families during stressful situations. They coordinate care with physicians and specialists. They help prevent complications. And perhaps most importantly, they act as an early warning system. Here is a truth that deserves more attention. Modern healthcare isn't only about treating problems. It is about identifying problems early, before they become bigger, before they become dangerous, before they become emergencies. That is where nursing becomes incredibly powerful. Think about it. A pediatric nurse may notice a child becoming increasingly lethargic. A maternity nurse may recognize signs suggesting a postpartum complication. A neonatal nurse may identify subtle changes indicating a newborn needs immediate attention. These observations create opportunities. Opportunities for earlier intervention. Opportunities for faster treatment. Opportunities for better outcomes. And parents play a role too. Nobody tells you this enough. You are part of the healthcare team. Ask questions. Share concerns. Speak up when something feels wrong. You don't need a medical degree to notice changes in your child. You don't need professional training to communicate concerns. Good healthcare teams want collaboration. Because when healthcare professionals and families work together, everybody benefits, especially the patient. But there is one dangerous belief shared by millions of parents. And it causes people to ignore warning signs every single day. The scary part. It sounds completely reasonable, until it isn't. The belief is this: if something serious was happening, I would know. Not necessarily, and that is not meant to scare you. It is meant to educate you. Many serious medical conditions don't begin with dramatic symptoms, they begin quietly, gradually, almost invisibly. A newborn feeding less effectively. A child becoming unusually irritable. A mother developing symptoms she assumes are normal recovery. The human brain loves explanations. We tell ourselves, it is probably nothing. They'll be okay. It is just a phase. Sometimes we're right. Sometimes we're not. That is why healthcare relies on evidence. Assessment, monitoring, observation. Patterns, not assumptions. Here is the truth nobody likes hearing. Ignoring symptoms doesn't make them disappear. Waiting doesn't always make things better. And hoping something isn't serious isn't the same as knowing it isn't serious. Awareness matters, early action matters. And paying attention matters. More than most people realize. Now here is the encouraging news. Healthcare for mothers and children has improved dramatically. Medical training continues to evolve. Patient safety systems continue to improve. Technology continues to advance. Knowledge continues to expand. And outcomes continue getting better. But the biggest advantage isn't technology. It is awareness. Awareness creates action. Action creates intervention. Intervention creates better outcomes. The goal isn't to live in fear, the goal is to stay informed. There is a huge difference. Fear paralyzes. Awareness empowers. Fear says something bad will happen. Awareness says you'll be prepared if something does happen. And that is exactly what great maternity and pediatric nursing is all about. Preparation, observation, compassion, action, every single day. For every single patient. If you found this video valuable, subscribe right now. This channel breaks down healthcare, parenting, child health, medical careers, and patient safety in a way that is practical, engaging, and easy to understand. Leave a comment below. Have you ever had a nurse make a difference in your life or your child's life? Share your story. And if there is a healthcare topic you want covered next, drop your suggestion in the comments. Medical disclaimer: this content is intended for educational purposes only, and should not be considered medical advice. Always consult qualified healthcare professionals regarding diagnosis, treatment, or medical concerns. Until next time, take care of yourself, take care of your family, and never underestimate the people quietly protecting lives every day behind hospital doors.